When I grew up in the 1950s and 1960s, when I was young, in my village, which I said was very rural and remote, I used to hear about women and young girls who would die in the hospitals. Sometimes some of them young women, adult women giving birth, but some of them used to die, and we hear they have died, or you hear their child died during the delivery, and that concerned me a great deal. I said, what can one do about this type of thing if one had an opportunity? And that sort of directed me to the field of medicine in a way. Not that I was very clear, but I hoped that maybe if I grew up, if it was possible, if I could become a doctor or a health worker, that would be something that I would want to think about and deal with and see whether I can play a role there.
This book series honors Dr. Jotham Musinguzi, a distinguished Ugandan public health physician and population policy expert. He has dedicated his career to placing population issues at the center of Uganda's development planning and decision-making.
The beginning of these issues, to be honest with you, I wasn't so sure that it would be that I would play at the national level or even regional level, or leave alone global level. That was never anything I started on. As I told you, I just wanted to see whether I can help become a health worker. I wasn't even so sure that I had to be a doctor. I thought I could be a nurse, midwife, health assistant, and help these women and young girls not to die and their children not to die. So that was a background. But as I did that, as I studied medicine, the issue of reproductive health, family planning, as it protects the lives of not only children, but of women and young girls, became an issue. And because of that, I decided to specialize in obstetrics and gynecology. And that sort of pushed me in that field where I had to see the role of family planning and reproductive health as a way of preventing these deaths of women and young girls. And I think that is where eventually, step by step, of course, with the help of different groups of people and different exposures along the line, and that's how I got into population.
So the book is a celebration of the man, Dr. Jotham Musinguzi, who has been at the helm of advancing the works and the implementation around population and reproductive health in Uganda and in Africa. The book is a collection of 14 chapters from scholars around Uganda and Africa and beyond, and it talks about works around population and reproductive health that Jotham Musinguzi has been at the helm of over the last 4 decades of his professional life.
Dr. Musinguzi served as Director General of Uganda's National Population Council and currently advises the President on population matters. Beyond Uganda, he founded the Partners in Population and Development Africa Regional Office in Kampala to promote regional collaboration. In 2013, the United Nations recognized his outstanding contributions with the UN Population Award for advancing the goals of the 1994 International Conference on Population and Development.
Well, it is not just one policy that one can say this is the real thing. No. It is a number of, yes, policies, strategies, programs, activities. And so, for example, let me give a specific thing. In the early 1990s, a new government came in, the government of NRM. And because Uganda had had a troubled area in the 1970s, 1980s, programs like immunization of children had become problematic. And me as a doctor, an obstetrician gynecologist, who had also studied public health, I realized that some of the efforts, even of we doctors, by just sitting in the hospital, it is like you are on a river, you are seeing people coming, being thrown. You are at one end, you are just seeing bodies coming. They are drowning somewhere upstream. And for you as a doctor, your job is just to wait for them there. Why don't you go and prevent them from drowning? Because it is much more easier, it is more important to prevent them from that. And so the issue of immunization and what it does to children, under a mass scale, I said, no, I should help government. Since I know I have the knowledge that immunization is useful, I should make sure that government policies and government activities and programs make sure they prioritize vaccination of young children, because this can be done on a large scale, and therefore the impact would be big. And so I decided to engage government, policymakers in the government, the people who are heading the Ministry of Health, but also the political leadership, to make sure that they prioritize immunization. And I think that immunization program, I feel very proud about it, because one, we have seen over time, not just a short period, but over time, life expectancy in Uganda has gone up. And Uganda's average life expectancy in 1990 was a mere 43 years. As we speak now, we are 68 life expectancy. That is adding 25 years of life expectancy in a relatively short period of history. So that is something else. But not only that, it also has, immunization has a lot of implications for the health of people, for if they can live long, they are healthier. You can also tackle issues of development. And so that is why you link roles like those, family planning, immunization, public health, with eventually policies and programs that impact on development of people. And you can do that, it acts on a wide scale. It is not just one individual waiting in the hospital to wait for somebody who is sick with diabetes, with blood pressure, with malaria, that you are treating them there. You are preventing, you are doing prevention. And that prevention is not only tackling one person, but a large scale. And those are what are called impactful programs. They are very, very impactful, unlike just waiting for patients in the hospital and dealing with one person at a go. And so those are the type of things that I think made a difference.
Under his leadership, Uganda hosted the landmark 2012 International Conference on Family Planning, which led to significant global commitments.
To be honest with you, of course, I feel humbled by this recognition, but I am also mindful that this recognition is not just mine alone, because a lot of this work I have told you, in some of them I just went talking to people. I was a messenger, and other people were the ones acting. And that reminds me of a story of somebody was asking, how do you see far? How come that for you see far? And he told them that when you see me seeing far, it is because I stand on shoulders of giants. I'm not the giant, I'm not the what, but I have had the opportunity to stand on shoulders of giants, and therefore I could see far. The education I had, the contacts I had, and fortunately also the people that opened their doors for me to speak to them and to be able to do the work. But also the people that I have worked with, the groups that I have led in the population program, the population secretariat, as was called in the 90s in the Ministry of Finance, the National Population Council created by Parliament, and being also regional director for Africa for the population program. all of those have given me an opportunity to work with people, to lead groups, and make sure that we achieve something. So this recognition, I think, is deserved by the people that I have worked with for so long and who have had a tremendous impact on society, even when I have sometimes been the face of it. But they too should take credit, well-deserved credit.
Thank you. The book launch is expected to happen on the 17th of October, 2025 at Makerere University, the main building, from 2 to 5. And we expect authors, researchers, practitioners in Uganda and beyond who have walked the journey of population and reproductive health with Dr. Jotham Musinguzi, either as researchers, as practitioners, or as fellow co-workers in the field. We also hope that at the launch, we will present a paper, or we will present a call to practitioners and funders on the need to provide data at the lowest level, which is the parish level, to aid and contribute towards policy making and budgeting at the district level. We are going to be launching this as a pilot in his own district, Kanungu, where Dr. Jotham Musinguzi comes from.